Good afternoon, ma'am. I am Musli Kilgan, taking up Bachelor of Science in Nursing at the University of Southern Mindanao, Sikihor. This time, I'm going to perform a return demonstration for starting an intravenous infusion. The first procedure is to verify the IV solution order on the MAR or CMAR with a medical order. Check for any inconsistency as well as the patient allergy. The rationale behind that procedure is that it will ensure that the correct IV solution will be administered and the correct rate of infusion will be infused. Then we have to check for color leaking and expiration date of the IV solution and know the techniques, purpose, precautions, and medications ordered because this knowledge and skills will ensure a safe infusion of the IV solution, and then it will prevent error. Then the next procedure is to gather all the necessary equipment and bring it to the bedside. It will save time and facilitate the completion of the procedure. Then after that, we have to perform hand washing or hand hygiene and put on personal protective equipment if indicated. This will prevent the spread of microorganisms. Then PP is required based on transmission precautions. Then after that, we have to identify the patient. This is to ensure that the right patient receive the intervention, and it will help in preventing error. Then the next procedure is to close the curtains around the bed and the door of the room if possible. This is to provide privacy to our patient, and then explain the procedure to the patient, what you are going to do and why you are going to do it, because it will relieve patient anxiety and facilitate cooperation. Ask also the patient for his allergy because he or she may have allergy related to IV solution we are going to infuse in the tape we are going to use in anchoring the devices. Then to prepare a administration set in the IV solution, we have to the first procedure is to compare the IV solution container with the MAR or CMAR to ensure that the correct IV solution will be administered and infused. Then we have to check the expiration date of the IV solution to prevent making error. Then label the solution container with the name of the patient, the solution type, the additives, the date and time it will infuse. Then because the other healthcare provider working the infusion will know the name of the patient and the time we infuse the solution in what type of solution. Then we have to remember to maintain sterility or aseptic technique in opening sterile packages, including the IV solution. Then we have to remove the administration set from the package. The rationale behind that is it will prevent the spread of microorganisms. Then the next procedure is to apply label on the tubing reflecting the date or the day for the next set change. This ensure the adherence to the facility policy regarding the changes and administration set. Then after that, we have to close the slide clamp or roller clamp on the IV administration set. This will prevent the air in the fluid from entering or moving into the IV tubing. Then we have to invert the IV solution container and remove the cap on the interside, taking care not to touch the open area or the exposed area on the interside. Then the rationale is it will allow us to access easily the interside. Then touching the open area will prevent or will result in contamination. Then we have to remove the cap on the spike from the administration set. Then we have to use a twisting and pushing motion to insert the administration set spike into the site of the IV site into the point of entry into the IV solution, because it will the inserting the spike will puncture the cell on the IV container and allow access to its content. Then after that, we have to hang the IV container on the IV pole, because the suction will cause the fluid to move into the drip chamber of the tubing. And then we have to squeeze the drip chamber and fill it at least halfway, because fluid will prevent the movement of the air into down the tubing. Then we have to open the IV tubing. the clamp of the IV tubing and to allow the fluid to move through it. Then allow the fluid to move until all air bubbles have disappeared and until the entire tubing is filled or primed with the IV solution. That technique will prepare the IV solution to be administered or infused and remove the air from the tubing, because if the air is not removed in large amount, it can act as an embolus. And then the next procedure is to close the clamp, because remember that some brands of tubing may require the cap removal at the end of the IV tubing to allow the fluid to flow. Then we have to maintain its sterility. Then after that, after all the entire tubing is filled with IV solution, we have to close the tubing. The rationale behind that is touching the open end of the tubing result in contamination, and the administration set would be discarded. Then to initiate a peripheral venous access, we have to place the patient in low Fuller's position in bed, then place a pad or protective towel under his or her arm, because the supine position will permit and allow us to use either of the arm. Then it will permit a proper and good body alignment. Then the towel will protect the underlying surface from blood and other fluid or contamination. Then we have to provide emotional support to the patient, because he or she may experience anxiety, because some patient may fear the needle stick or the IV infusion in general. Then we have to select and palpate for an appropriate vein, because using the appropriate vein will decreases the discomfort to our patient and will minimize the damage to the body tissues. Then if the site is hairy in the agency protocol permit, clip a 2-inch area around the intended site of entry, because hair can harbor microorganisms and inhibit the adhesion of the dressing. And then the next procedure is to put on glove to prevent and protect the nurse from being in contact with the blood and other body fluids. Then we have to apply tourniquet 3 to 4 inches above the venipuncture site to obstruct the venous blood flow, therefore distending the vein. Then we have to direct the end of the tourniquet away from the site of entry. Make sure that the radial pulse is still present after applying tourniquet, because interrupting the blood flow to the heart will cause the vein to distend. Then distended vein is easy to see, then to palpate, and easy to insert the needle. Then the end of the tourniquet could contaminate the area of insertion if its end is directed toward the insertion site. Then the tourniquet may be applied too tightly, so assessing the radial pulse is necessary. And then checking the radial pulse ensures that the arterial blood supply or the arterial supply is not compromised. Then after that, we have to instruct the patient to hold the arm below the heart, because that level will help to distend the vein by filling them. The next procedure is to ask the patient to close the fist and open it, and observe and palpate for a appropriate vein, because contracting the muscles of the forearm forces the blood into the vein. Therefore, the vein will be distended further. But if the vein cannot be palpated or felt, we have to massage the patient's arm from proximal to distal end and gently tap over the intended vein, because massaging and tapping the vein will help to distend them by filling them with blood, of course. Then, or we can remove the tourniquet and place or apply a warm and moist compress over the intended vein for at least 10 to 15 minutes, because warm and moist compress help dilate the vein, therefore distending them. Then the next procedure is to cleanse the site with an antiseptic solution using back and forth scrub motion or scrub friction for at least 30 seconds. Do not blot or wipe, and allow it to air dry completely, because microorganisms on the skin can be introduced into the tissues or the bloodstream when we insert the needle. Then using the non-dominant hand, we have to place it 1 to 2 inches below the needle entry site to hold the skin taut against the vein. Then we have to avoid touching the prepared site and ask the patient to remain still while performing the venipuncture, because pressure in the vein and surrounding tissues will help prevent the vein in moving while we inserting the catheter or the needle. Then if we touch the intersite with our unsterile hand, it will be contaminated. Then patient movement may prevent the proper technique for inserting the needle or the catheter. Then enter the skin gently while holding the catheter with non-dominant hand on its hub, and then we have to place it in a bevel side up in 10 to 15 degrees angle, and then insert the catheter from directly over the vein or from the side of the vein. Then we have to follow the course of the vein while advancing the needle into the or catheter into the vein. The rationale behind the three procedure is that it allows the catheter or the needle to be inserted into the vein with a minimal trauma and deter the or prevent the passage of the catheter through the vein. Then, when the blood returns through the lumen of the needle or the flashback chamber of the catheter, we have to advance the catheter into the vein until its hub is on the venipuncture site, because the rationale is that the tourniquet causes the increased increased venous pressure, resulting in automatic backflow. In automatic backflow, indicate that we have entered the site. Then, after that, we have to release the tourniquet and stabilize the catheter with our non-dominant hand. Then remove the protective cap from the tubing and attach it to the catheter by not touching the point of ensure the point of connection. Then secure the connection. The rationale behind that is bleeding is minimized and the patency of the vein is maintained if the connection is made smoothly between the catheter and the tubing. Then we have to start the infusion by opening or slowly opening the slide clamp. Then, after that procedure, we have to inspect the insertion site for sign of infiltration and leaking, because that sign will indicate that the insertion is not successful or unsuccessful. Then it should be discontinued. Then we have to open and apply the skin protectant and apply it to the site, making sure that the entire site to be covered with the dressing is applied have skin protectant, because it will aid in the adhesion of the dressing and decreases the risk of discomfort and trauma when we remove the dressing. Then we have to place a sterile and transparent dressing on the insertion site, because the transparent dressing will allow easy visualization and protect the site. Then loop the tubing near the intersite and anchor it with the non-allergenic tape. Then close the site, or nail using non-allergenic tape. Close the site. Then the rationale is that the weight of the vein is enough to pull the vein out of the pull the catheter out of the vein if not well anchored. Then the next procedure is, if infusing by gravity drip, adjust the flow rate to correct drop per minute until the correct drop per minute is achieved, to ensure that the patient receives the correct volume of the solution we need to infuse. Then label the IV dressing with the time, date, site, the time and size of the catheter used for the infusion, because it will allow the other healthcare provider working with the infusion to know the type of the devices we used in infusion, and then the site and the time it was inserted. Then IV insertion site, because IV insertion site is changed every 48 to 72 hours, or it depends on the protocol of the agency. After that, we have to apply a IV stabilization or securement devices, then explain its purpose to the patient. We have also to explain the importance of safeguarding the site while using the extremity. The rationale is that securement devices will preserve the integrity of the access device and prevent catheter migration or the loss of access or the dislodgement of the needle from the vein. Then remove the equipment and return to the patient to a position of comfort. Then lower the weight if necessary because it will give the patient the safety and comfort. Then dispose all the stylet used in other inappropriate sharps container. Then discard the supply, and of course remove the glove and other personal protective equipment if used, and perform hand hygiene. This is to properly reduce the risk of transmitting the microorganisms or infection, and will reduce contamination of other items. Then, as we know, hand hygiene deter the spread of microorganisms. Then the next procedure is to document all necessary information to the patient chart because it will communicate to the other healthcare provider working with the patient or working on the patient in the infusion. Then the last procedure finally is to return to check for the flow rate and observe the site for any sign of infiltration after 30 seconds and at least hourly thereafter. Then we have to ask the patient if he or she experiences any discomfort or pain regarding the IV infusion, because the rationale behind that last procedure is continued monitoring is important to maintain the correct flow rate and early detection of the problems ensure a prompt intervention. Then that's all for starting an intravenous infusion. Thank you.